Today we had a sim training. This is one of the things that made me realize like how much I've learned on the job. We've done these simulations throughout med school as well. Today was like I finally realized, oh my god, I actually can do so much. The case I got that I was leading was like a stroke. I got handed over by the nurse. Like this guy had like some weakness, so I like immediately went in. I was like doing the NIHSS, doing A to E, ordering a CT head. All of these things I could do like a lot more smoothly, and you don't realize it when you're working every day, but suddenly when you put on a spot, I realize how much I know basically. But it's around 8 p.m. and basically because of doing this mandatory training today, I couldn't go on the ward today, and now I'm just texting my friend slash colleague Aria, which you've seen in the previous vlog. He is the late F1 today, like covering until 8 p.m, but he still hasn't started updating the ward list. So I'm just asking him like if he needs any help, because like I probably will just go in now and help him with the list, because tomorrow I'm the early F1, so I would need to know the patients anyways. So I'm probably just like literally as I'm talking to you, I'm seeing my computer screen here, and I'm probably just gonna go in. I need to know the patients anyways. But this is the thing, like when you have so many jobs and so many patients, and when a specialty gets really like intense, you help each other out. So I want to help others because others have helped me before. And I mean, the F1 on the ward today basically had to do the same job but without me, because I have mandatory training. So anyways, I'm gonna go and help him with the list and get to know the patients, which is helping myself tomorrow morning as well. So hey Luna, I'm gonna go in at to help a friend, so you're gonna stay at home and be a good girl. Oh sorry, my slipper's in the way, but I don't know why she just fit herself into this box. I think they just love boxes. Definitely a skill to be filming my life while everything is happening in the intense rate as they are. But then yeah, it shouldn't stop me from filming. And getting this like tiny camera has been so helpful. I try to shoot with my like real camera when I can, but having this like little action camera has been like the solution to filming like these like medical vlogs. It's no way it's appropriate to bring like a Sony camera on the ward, but when I can still like take out this like mini camera and like film some footage of myself doing the job. It's not like you can just film whatever and whenever. It's quite the opposite, right? You can you have to be super sensible in terms of what kind of footage that you can get without risking any patient confidentiality, especially it's a vulnerable place and it's like a high pressure, fast paced environment. Cannot allow this whole filming thing slow down my work or affect the quality of my work. So it's definitely like art to master. I actually had a lot of fun, and we're just like talking and laughing and doing the list together. So it's actually really fun, and now I kind of know all the patients on the ward for tomorrow ward round, which is a bonus. And it's gonna save my time tomorrow morning as well. So it's all good. And now it's like 10, so it's a perfect time to go home and take a shower and go to bed. A success, and it's a super difficult one, so I'm super happy. I put a green cannula, which is like the biggest size, in an elderly gentleman's hand with very like flimsy veins, very frail veins, and it just went in like that. It was beautiful. It was beautiful. I'm home. It was such a long day, I'm not gonna lie. Yeah, it's just getting busier and busier, and my registrar is just stuck in the ED the whole day. You would not believe this. We had 9 CTs to order and vet and chase. It was just crazy. Everyone needed a CT KUB, a CT urogram, a CT AP, a CT PA. Like, it's just there are so many CTs, and CTs are usually like the urgent jobs. Like, I remember ordering everything and then calling up the CT. I was like, can I vet some scans for my patients? And we just went through a whole list. And then there were 3 discussions with interventional radiology. Basically, it's like the patient needs like a procedure, and you need to discuss it with a consultant in interventional radiology, basically to say like, oh, do you think it's a good idea to do this procedure? And they would agree, and then you would fill out a form, and then that would happen. So my registrar did the discussion, but I was responsible for filling out those forms. And then there were like 5 or 6 patients getting discharged, so need to do their discharge letters and their TTO, so that's take-home medications. The CTs, because they needed to inject like a contrast for these CT scans, they need a grain cannula, and basically a grain cannula is like one of the largest cannulas you can get. Like the needle is like this long. There were 2 patients. The nurse in charge came to us, and then she was like, we don't think we can put a cannula in. Can you like escalate it to the vascular access team? Which is like a specialized team to put in cannulas. This is the interesting thing I've noticed about like the hospital I work in, right? For the record, I'm not like looking for excuses or anything. It's just like a fact. Basically, our nurses are so well trained, and they're all very, very skillful, and they can do a lot of stuff. The nurse in charges basically are more experienced than all F1s. That's my opinion. When the patient needs a cannula, the nurse is usually in charge of doing these cannulas. And today there was like a patient who needs a CT, and the CT already sent porters to the ward to bring the patient downstairs to get a CT, but for some reason the patient didn't have this bit like massive sized cannula in them, and then the nurse came to me to escalate this and saying, doctor, this patient is really hard to put cannula in, so can you please help putting a cannula in? Now the interesting thing about this is that nurses do cannulas almost every day, and they are very, very good at doing cannulas. But when they can't do a cannula, or when the cannula is specifically difficult, they're supposed to escalate to the junior doctor, who don't usually put in these cannulas. So I was there, and I'm always like having this mindset like, oh, if you bring the job to me, I will either way give it a good go before trying to seek help or anything. Plus, it was quite urgent because the porters were already there. Like, there was a slot for the CT scan. So I was like, you know what? Let's get the things ready. Let's try to do it. And then, like, I'm actually really proud because I actually got the cannula in. And then it's a massive needle. I mean, if you're not a medic, it's probably hard to imagine. But how big is it? As probably, like, if you get a pan and you take out, like, the inside, the cheapest type of pan. Like I'm reviewing a product like this, and it's as thick as the tip there. It's a very, very like thick and long. It's probably like this long, like half of a pen long, and then you need to get this like big needle and fit it into someone's vein. And then the patient was like 70 plus, right? So he's got like really like soft feeling skin, and then the veins are very collapsible, we call it. So it was a really difficult cannula, and I think sometimes like it's because of the pressure. I was like, right, let's just try it, and then I actually put the cannula in after the second attempt. But it was such a big needle, like I could see even like the cannula tube inside the patient's vein, and I could see the flush bag, and on the inside I was like, yes, it's in. But when I like pushed the tube in like into the vein like a bit more, I could see like the tube was probably like as just about like fitting in the vein. Like it's like if the vein is like that, and then the cannula is like just about, and then I was pushing it, I could see the tube like moving about underneath the patient's skin. I could see my tube, and vein was just sheathing the tube, and it was so close. That's why I was like so excited and happy after I got that one in. And then that I got that one in, I flushed, it was smooth, it was perfect. And then I had to do another one. Like there were two cannulas that I had to do. They were like, the nurse in charge was like, "Oh, doctor, there's no way we can get this. I tried to take bloods from the patient in the morning, I couldn't get it. So, like, you can try if you want, but we probably need a like an ultrasound machine to guide it." But now I always think if there's a chance I would try it, because the thing is like, firstly, you would only get better at these if you like practice, um, and they've still like, with everything that I've said, they still escalate this to the doctors. You have to like rise up to that. Is that so? Like you can't just say like, oh, you can't just say, oh, what I just told you. Like you can just say like, oh, if you can't do it, I can't do it. Because then what's the point of you being there, right? So I was doing those cannulas and I got both of them in, and then it was such a proud moment. And low-key, like, because in my mind I still feel like the nursing charge are always like a bit senior than myself, maybe a little bit more than a bit senior, because they're so much more experienced, and then they've been on urology for long time. So a lot of times like I ask them for their opinion, like what do you think was usually done in this case. So I felt like today I got like some respect from the nurse in charge. I was like struggling in there and I got it in. I felt like, yes, I got it in, like that's perfect. But I do this, right? I'm sure like a lot of you do this as well. You struggled so much in there, but you come out, you pretend like it was easy. Like and I was like, yeah, it's all done now. You'll see that green cannula beautifully sitting in the patient's arm, flushing while working. Like it's just the cannula's in. Uh, but yeah, it's a bit silly. But yeah, I felt really proud about that. But overall, it was a really busy day. And here's another thing, like I'm not scared to talk about this on YouTube because I actually stand by this. I think this is very important. The other F1 who worked with me, who saw some patients in the ward round this morning, for some reason, one of the registrars or one of the senior doctors took over the computer she had and started documenting using that computer. I think that registrar wanted to present the patient's case to the consultant, right? There's a whole chain of hierarchy, like seniority in the ward round. And then that doctor saved the notes and signed the notes. But because it is in my F1 colleague's name, the signature basically shows her name. So I was basically telling her like, with all of these, if this happens, you have to make another note saying like the note above was made or written, the plan above was written by this doctor. So it's not like, it doesn't matter if that plan is good or bad, or if that plan is clear or unclear. Always stand by this. Like you shouldn't take responsibility for something that other people have written that's under your name, because at the end of this is like our GMC, right? And the nurses, when they action these plans for these patients, and there's any problems or if there's any ambiguity, they come to us because it's an under name, right? This is like, you're the doctor who saw this patient during the ward round and you made a plan, you wrote the whole documentation. So if it wasn't you who wrote it, you have to make it clear that it wasn't you, it was a different doctor, right? So sometimes I do think as F1s or as junior doctors, you can have a registrar who's a lot more senior than you. I get that as well, who would be in a rush and they just take over the computer and they just needed to check something, and then they held on to that computer, which sometimes isn't the most appropriate thing, I believe, because in a ward round, like I actually have a job to do. Like I'm there to scribe and it's a legal document. I'm here to take down everything the consultant is had the conversation they have between the consultant and the patient. But sometimes these things happen and it's a high pressure situation, it's very intense, it can get very intense. Then I think the most important thing is like to protect ourselves. If it wasn't us who wrote the plan, don't just stick with it, especially if that plan wasn't clear. I don't think it's a negative thing. I don't think it's a bad thing to say. I think it's a generally important thing to point out. So that's just that. But it's Tuesday night and tomorrow I've got a day off called self-directed learning day. So I think I'm going to do some admin, and I need to send off a few tickets and a few forms. I've had the privilege to teach a group of Oxford students and it was really fun. I made like a little scenario for them and I think it was fun. I think they enjoyed it. I don't know. It's hard to get honest feedbacks sometimes, but I was in this teaching series for Oxford Uni students, and my topic was acute abdomen. So I kind of just made some scenarios and I kind of plotted out a whole like script, and I divided them into like, oh, you two are the F1 on course, you two are the nurses, and you two are the F1 overnight on course. And I gave the nurses some scripts about like, I wrote down whole like little paragraphs like, oh doctor, this patient is really unwell, what do you want to do? And I wrote like in bracket, the right answer is to do some obs, give them paracetamol, and send off blood culture, and escalate to scene. And like I wrote some like correct answers, and then we can like compare that or give feedback to the two F1s who were running the scenario. And then I made the two F1s hand over to the overnight F1s, and then they can practice like how to hand over things using like a specific format we call SBAR in medicine, in the UK at least. And they could practice that, and then the overnight F1s, you know, what are kind of the scenarios that you would see as an overnight doctor when there's like less senior support, when you're not sure what to do, what can you do to keep the patient safe. So I think it was good. I think they enjoyed it, and you know, people had a good laugh as well. So I'm just gonna send them some feedback forms. I'll catch you guys later. And this is Wednesday. I actually woke up just now, it's like 10, so I definitely slept really well. I'm gonna eat something and go to the town center. And Luna, get off! This is what I mean when I say, if I don't wash something for like a minute, she goes and investigates it. But I'm gonna have some eggs and some like Chinese pickles that my parents brought when they visited me. I need to do something physical today, but first I'm gonna go to town and I need to do those things I said I was gonna do yesterday. And I can see the sun peeking out today, which is really good because it's been like very grey and rainy in the UK like the past few weeks already. Mate, you have no idea how cold it is. The thing is, like, my body hasn't woken up properly and it's so cold. Like, what degree it is? It's so cold, man. It's 2 degrees and my body hasn't woken up, and it's like just shivering. Like, I was just shivering on the way here. And it's one of those nights, I'm not sure if I fell asleep at all. Like, I think I must have slept very light, because I did have a dream. I low-key remember like a dream, but I also felt like I could have woken up any minute if I wanted to. So I felt like, yeah, it was like a 5-hour sleep as well. No excuse, right? No excuse to call in sick, because I'm still here, man. I'm still here. But I'm gonna
have a breakfast, and go on to the ward. Today is a normal day, so I finish at 4:30. Hopefully I can leave around 5 p.m. Let's eat.
Okay. Thursday evening. We're so close to the end of the week. I'm getting more and more excited. But before I say anything, before I talk about anything that happened today, I was like cooking, right? Do not ever cook steak in an air fryer. It is so bad, man. I was even like watching some YouTube, some lady like who clearly lied to me because this lady was like, oh, like cooking a steak on the pan is obviously the best. Is it the best thing to cook in an air fryer? No, but it's a very close second. It wasn't. It was so bad. It was so bad because I'm wearing scrub. Like I'm gonna be professional, but it's like, have you tasted like fishy, bloody, dry wood? That's how it tasted like. So I had to like throw away the rest of the steak and make like instant noodles with like eggs. At least I got some protein. But yeah. So today was okay. Today was actually like, as you can tell from my tone, it wasn't too draining, it wasn't too bad. I left on time at 4:30, and we had loads of discharges in the morning, but most of them were like elective cases, and it was quite well staffed. There were four of us FY1 doctors, so the ward was actually okay. It was a bit of a shame because around like 4 p.m. one of the registrars like sent to the group chat like who wants to come and see a procedure, and I was really excited. I was gonna go see, but like I actually was the first one who get there, and I saw the patient first with the registrar, but then all the other junior registrars arrived, but and then and then because this is urology, right? So these procedures are very intimate. So these patients can present with sometimes quite awkward presentation. So for this particular gentleman, like there's a gentleman in A&E, and he's had this like erection going on for since 6 a.m. in the morning. So it's like past 8 hours, and yeah, so it's quite embarrassing for them. So it's quite unfair if like a whole big group of people like watches the procedure. But the procedure to deal with that is basically you have to numb the area, and once they can't feel the area, you get like a large needle, and you draw blood from the veins from the penis, and that's how you kind of reverse that erection. So it would have been a really cool procedure to see, because all the junior registrars, like the core trainees and the ST ones, so they also came. So I kind of backed out. I said like, leave the opportunities for those core trainees, because they actually will be doing these in a couple of years, which I do appreciate. So it's a bit of a shame I didn't get to see that in the end, but otherwise the day went like quite uneventful, I want to say. And I can say it now because the day's over. I would never say this in the middle of a day, because you never know, you might jinx something. So I've got everything prepped. The patient really wants to have her lunch first, so it's giving me like a little gap just to go through everything, because it's my first time putting a 3-way catheter. It's a much bigger catheter than a normal one, but I'm just going through in my mind like, what do I do when I go in? So I clean the area, and then I put on sterile gloves, and I inject the instiller gel, which is like a lubricant, with a bit of like anesthetic effect, and then I without touching the catheter, I put the catheter in all the way to the end of the catheter into the bladder. And then I see urine coming out from the other end of the catheter. I attach the urine bag, and then I use a syringe, inject with 30 ml of water, and I inflate the balloon. I retract the catheter in place, I clean the area, and I thank the patient. And that should be how it works. And then the nursing staff will kindly set up the irrigation, which I can explain later. But the reason it's a 3-week catheter is because we need kind of a continuous flow of water to go into the bladder so that we prevent blood clots from forming, which is quite cool. So yeah, so I've got a few minutes and then I'm gonna go do that. So I went climbing tonight, which was great after work, and I've got the weekend off so I can take a break. And next week it's going to be encores again. It's going to be nights, 12.5 hours per night for 4 days in a row on general surgery. So it's going to be super intense. I don't know. My next rotation is going to be colorectal on general surgery as well. If I'm completely honest, I'm not looking forward to that. Yeah, I'm just not surgically inclined, and urology has been super fun, but also the seniors are super supportive, and it's very structured. But from what I know, general surgery has a different vibe. Let's just leave it like that. It has a different vibe. The culture is different, and it's a lot more chaotic and intense. And we currently do general surgery on course, so we kind of get a taste of that already. And so in about 2 months time, I'm gonna be fully a colorectal F1 doing a general surgery job for 4 months, and I don't know how that's gonna go. I don't know. That's all I'm gonna say. I guess we'll find out by then. I'll keep making these vlogs, so we'll see how it goes. Got a few things to do tonight, so it's time to unbox some stuff I bought from Amazon. This week was also payday, so it's time to spend some money. I've got, let's see, a little like plate for my camera, which I will not open because this is what I mean. Like sometimes you get paid and you just feel like I want to spend some money because I deserve it, but then like I don't really need anything. And then like it's like 11 p.m. or 12 a.m. and then you're really tired, and then you buy something, and then the next day you wake up and you're like, I actually don't need it. Like I actually will not be carrying this camera on my backpack, but this is how it's supposed to do, and it had like really good reviews. But I think I'm just gonna return that. I don't think I actually need it. It's this little thing is 30 quid, by the way. Like I think it's supposed to be really well made. Excuse me. Luna is very, very interested whenever there's like a new box. Oh, whenever there's a new box or like a packaging, she always needs to like she's like an inspector. You're like an inspector of like my Amazon boxes, aren't you? So the first thing, which I think I will keep, is this. So it's a pet glove wipes. I saw this online. I think I was just seeing I was just scrolling, and this seemed like such a good idea to clean like Luna's like paws, just because sometimes she's really like persistent about like getting on top of me, like cuddling, and then like I literally see her going to the litter. I just feel like I need something to like keep cleaning her. So this looks like such a good idea. We're gonna try this in a second. And I also got, Luna, you can have this box. I know you want the box. She's been waiting. Some cat toys. Like she has, we have these, but she's been breaking them, and the ones that I got like recently are like really bad. But these costed like £10, so it's fine. So we're gonna play with her with this, but not today because it's already like 10 p.m. So that's it for this vlog, I want to say, because it's Friday evening and it's been a week, it's been a long video. If you've watched the whole thing, which is probably 1 or 2% of my audience, then please leave a like and comment on how you feel, if you want to see more of this content. I've definitely had a lot of fun shooting this because yeah, it's just, there's no reason. I just feel like if you're ever thinking about making like a vlog, definitely do it. It's such a magical feeling when you're living your life, but you're also kind of a director of your own life because you're shooting like content. So you actually put in more effort to make your life more interesting, and then it actually becomes more interesting, and then you actually reflect a lot more because you want to reflect, and then you actually get the benefit of reflecting, you know? So it's great. But yeah, I think I'm gonna leave it for this video. Thanks so much for watching as always, and I'll see you in the next one.